in this video, I'm going to be doing a wound dressing change. Before this video, I already went ahead and checked the patient's orders and went ahead and offered them pain meds because they were in a decent amount of pain. So it's been about 45 minutes, and I collected my supplies in the meantime, and now I'm just going to be putting on PPE and going into the patient's room. So I'm going to start with my gown. Now I'm going to go ahead and put on my mask, making sure that the metal side is facing up, covering my nose. Next, I'm going to go ahead and put on my goggles. And finally, my gloves. And then before all of this, I performed hand hygiene. Making sure that the cuffs of my gloves go over the cuffs of my gown. Alright, now I'm going to go in the patient's room. Hi, Mr. John. My name is Megan. I'm a nursing student at Purdue Northwest, and I'm going to be doing your dressing. Now go ahead and check your ID stamp, please. And please state your name and date of birth. Alright, thank you. So I'm just going to go ahead and move the bed to where it's mine. And then I'm just going to go ahead and adjust you so that when I irrigate your wound, the fluid flows from the clean side of the wound to the dirtiest side of the wound. And I'm just going to put waterproof pad under your wound so that I don't get your bedding all wet. Alright. Dress my area here. Alright. So now I'm just going to go ahead and take off your wound dressing using the push-pull method. Just let me know if this hurts you at all, okay? So I'm making sure to loosen all the sides and then go ahead and pull it from the middle up off the wound. And then I'm going to go ahead and look at the XP date on the old dressing and assess that there is no odor and there is serious XP date. And then I'm going to go ahead and discard that. And then I'm going to go ahead and assess my wound. So I noticed a stage 3 wound with serious XP date, no necrosis, tunneling, or undermining. And now I'm just going to go ahead and measure it. So on the longest side, it is 11 centimeters. And then width is 3 centimeters. And then I'm going to go ahead and take a cotton tip applicator and measure the depth. So in the deepest part of the wound, it is about 2 centimeters. And then go ahead and discard that. Alright, so now I'm going to go ahead and take my gloves off. And I would note that information in the patient's chart. And now I'm going to perform hand hygiene. And I'm going to be setting up my sterile feet. So starting out, I have my drape. I'm going to go ahead and open this. Pick it up by the corners. Making sure it's high enough that it doesn't touch the table. And then I'm only going to touch the outside inch border. Making sure not to reach over my sterile field. So now that I have my sterile field set, I'm going to add my different items that I'm going to be using. So first I have an ABD pad. I'm going to go ahead and open this away from me and drop it on my field about 6 inches above it. And discard of that. Next, I've got some gauze. Open that, 6 inches above. And then I'm gonna go ahead and save this for later to put my saline in. Go ahead and open my irrigation tray. And then I'm gonna go ahead and save this for later to catch the fluid when I'm irrigating the wound. Now I've got some cotton tip applicators. I've got my ointment here to protect the skin barrier. I'm just going to squeeze a little bit on my field, part of that. And I'm just going to get some tape. And this is to put around the ABD pad. And I'm going to get 5 pieces, and the 5th piece is to mark my initials, date and time. Alright, and I'm going to go ahead and pour some fluid into my gauze container. And then I would mark this with the date and time for later use. And now, without turning my back onto my sterile field, I'm going to go ahead and put on my sterile gloves. I'm going to go ahead and do hand hygiene again. Goggles here. So I made sure that my packaging had no bricks in it, was not expired, as with all my other equipment. I open away from me, drop the package on my field. Then I'm going to go ahead and open it with a cuff side facing me, and then open it again. And then without touching the inside of the package, I'm going to go ahead and pull these flaps open. And then using my non-dominant hand, I'm going to pick up the cuff of the dominant hand's glove. Slide my hand in without touching the actual glove part, only the inside. Then using 2 fingers, I'm going to go under the cuff of my non-dominant hand's glove. Go ahead and slip my hand in that. And now, since I'm sterile to sterile, I can go ahead and adjust. Okay. Then I can pick up the middle of this and throw it away. And now I'm just going to adjust my sterile field since I'm sterile to sterile now. Gonna take a few gauze pads, my solution. All right, so now I'm gonna take my irrigation syringe, get some saline, and then for the rest of this procedure, my non-dominant hand is my clean hand, and my right hand is my sterile hand. So now I'm just gonna use my non-dominant hand to put the irrigation tray up to the patient's skin and go ahead and just irrigate the wound, making sure that the syringe is an inch above the patient's wound. And I'm just going to keep doing this until the wound flows clear. All right. So now I'm just going to take a dry gauze pad and dry the wound. Starting with that. And now, at this point, I'm going to apply my skin barrier. Okay, part of that. And now, at this point, I would put on any medication that would need to be put on the wound, but there is none today. So now I'm going to go ahead and use my sterile hand to pass myself a cotton tip applicator so that I can pack the wound. And I'm gonna go ahead and take my gauze, taking it up, bring it out a little so it's not too wet. And then I'm gonna go ahead and pull it apart a little. And now I'm just gonna fan fold it up into my one hand. And now using this cotton tip applicator, I'm just gonna go ahead and start threading it into my wound here. Making sure that all the surfaces of the wound are covered on the inside. And I'm gonna go ahead and discard that. Take some dry gauze here. Cover the outside of the wound. And then this is now a clean, not sterile procedure. So I can use both hands to get my ABD cap. Take my tape. And then I would put my piece of tape with my name, initials, and time on the middle. And now I'm just gonna go ahead and throw away my trash here. Okay. Are you comfortable, Mr. Jones? Alright, I'm just gonna go ahead and lower your bed back down. And then I'm just gonna put your call light over here so you can call me if you have any questions or need anything. Alright, let me know if there's anything else I can get you, okay? I'll clean up my area. And now I'm just gonna come up here and I'm gonna take off my PPE. Starting with my glove. Hard glove. Next, take off my goggles. Next, my gown. And then you can sure not to touch the outside of the gown. Pull it off. And I'm going to twist the dirty side in so I don't get contaminated. Discard that. And lastly, I'm going to take off my mask here. Untying the top first so that when it's untied, I can just go ahead and pull it away from my face and discard. And lastly, perform hand hygiene. Thank you.